Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is my partner of 40 years, Dr. Keith Applegate, who's also the managing partner at Family Practice Associates. Welcome.
Thank you very much, Jeffrey.
All right, now we got the top Googled healthcare questions.
Oh, I don't know I can compete with Google, but we'll give it a whirl.
All right. Well, let's start with a simple one that a lot of people runs top of the list. Why am I always tired?
Well, that's probably the number one question that I get. Probably the most common cause for fatigue would be lack of sleep. Many times we think we're sleeping well, but just ask your spouse, and your spouse will probably tell you you're snoring all night long and stopping breathing, and the spouse is probably having to wake you up. Stress is another cause of that, whether or not that's stress at work, stress at home, or financial stress that we're all under these days, or the stress of society with what we see on the news. Those are probably the two biggest causes, but you also have to worry about underlying conditions such as diabetes, heart disease, or hypertension. So those are probably the biggest things that we see.
Well, Google didn't give us all that information.
Well, I guess if you dig, you could probably find something in there.
All right, now this was kind of surprised me, kind of a little bit silly, but it says, how do I get rid of hiccups?
Well, my brother always used to scare me. So, you still go to the issue of trying to scare oneself, hold your breath, breathe in a paper bag. Those are things that we do at home. But as a physician, the time that I get worried or concerned with hiccups is if they've been going on for a period of 48 hours. If hiccups are going on for 48 hours, you're having trouble with choking, trouble breathing, then that's probably the time to go see the physician. And there are medications that we can use to stop those hiccups.
Well, I always tried pulling on the patient's tongue. Not real hard, but trying sometimes it works. Sometimes
well, I'll try that next time.
Okay. All right. Is pneumonia contagious?
Well, it all depends upon the type of pneumonia, and you have to realize what pneumonia is. Pneumonia is an infection of the lung tissue itself. And many times we'll see viral pneumonias, also bacterial pneumonias. But if it's a bacterial pneumonia, and pneumococcus is the most common cause, for which we recommend our patients who have chronic health conditions before the age of 65, chronic health conditions being asthma, diabetes, heart disease, or kidney disease, should have a pneumonia vaccine to prevent this common cause of pneumonia. Once we hit age 65, we do need a pneumonia vaccine. Now, viral pneumonias, you typically think of those as your coughs, colds, congestion, drainage. And from the standpoint of that virus, which is many times caused by the respiratory syncytial virus or one of the other rhinoviruses, they can be contagious. And so we do have to always cover our mouth, use your elbow, not your hand, and drink plenty of fluids, rest, and see your provider if things aren't getting better after 48, 72 hours.
Well, in Kentucky, kind of related to pneumonia, one of the top Google diseases is emphysema and asthma. Why does Kentucky, are we just a hotbed of that?
Well, you have to realize that here in Kentucky, living in the Ohio River Valley, we have a lot of plant material, a lot of plant matter. That leads to a lot of pollen. So a lot of pollen leads to allergy. Allergy will cause swelling in the lungs, and that leads to the asthma. Now, other aspects, as you mentioned, the emphysema, that has to do with our high rate of smoking. Cigarette smoking being so high in Kentucky. Over the many years earlier in our practice, we saw a lot of patients who did work in coal mines or in rock quarries exposed to dust. Not so much do we see that level of exposure at this point in time because of the coal mines shutting down, but we have occupational exposure and we have environmental exposure that triggers this.
Now, you've mentioned a couple of times high blood pressure, and that's one of the Googled questions too. What causes high blood pressure?
Well, probably I would have to say, in reflecting upon this, is obesity is a huge cause of high blood pressure. As your guests were on here earlier in your program regarding weight loss, we do know that when we reduce our weight, whether or not it's through surgery or medication or diet and exercise, that our blood pressures come down. So high weight is a huge contributor to this. Now, there are some individuals who just inherently will have blood pressure elevation because of our genetic makeup. And so those are some of the causes of that.
Well, that's great information. Maybe we can get you back to talk about other Google searches in a month or two.
Oh, I would love to.
All right. Thank you for coming in.
All right.
And don't confuse your Google search with your doctor's advice. We'll be right back.